everyone. Welcome to the live session. We are just waiting for the doctors to join. Hi, Dr. Shristi. How are you?
Hi, I'm good. How are you?
I'm also good. I just asked Dr. Priyanka as well.
Sure.
Just give me a moment. I just asked Dr. Priyanka as well. Okay, so Dr. Priyanka is also there with us. Sorry, everyone. Hi, Dr. Priyanka.
Hi, hi, Dr. Shristi. Hello,
Hi,
everyone.
Dr. Priyanka. How are
How
you?
are you?
I'm okay.
I'm good. I'm good. Doing good.
Okay, so let's not waste more of our time. Hello, everyone, and welcome to our live session. And today we have two incredible gynecologists, Dr. Shristi Raj and Dr. Priyanka. Dr. Shristi is a renowned IVF specialist, and she caters to all the mothers' needs. And then we have Dr. Priyanka with us. She is a postpartum and maternal health expert. So, in this session, we will be discovering a lot of things related from the beginning of the pregnancy, from the first heartbeat towards the end of the journey, towards all those healing things that are required in throughout the pregnancy journey. So, very warm welcome to the audience and especially to the doctors. Thank you for doing this to us.
Thank you
Thank you
for
so much.
having us.
Thank you.
Okay. So, a motherhood is a messy, magical, beautiful, challenging, and deeply beautiful journey here. So, we are celebrating that. We recently had Mother's Day as well. So, let's continue and talk about this beautiful journey with ups and downs, hilly bumps, hilly roads, everything with there is. Right. So, Dr. Shristi, let's start with you because the first thing, the beginnings only starts with you, right? So, suppose a female, someone finds out she's pregnant. What are the first things you think she should prioritize? क्या है ऐसा कि जैसे ही उनको पता चला that she's pregnant, she should must do that only.
Okay. That's a very great question, I should say. So, the first it's to find a good obstetrician she feels comfortable with. Then she should start her prenatal vitamins and scans. And lastly, she has to prepare mentally. The pregnancy beginning should start with a slow pace and a good, healthy environment. And it is always a picture perfect, and that's completely okay.
Right.
Yeah, and actually, when you say to prepare mentally, that is the basic foundation of a healthy motherhood journey because many a times we have this constant pressure of being happy and everything, but actually, it doesn't always go like happy moments only. There are tough ones as well.
Correct, totally. Because there are aches, there is nausea, there is mood swings, and everybody's journey is unique.
Right. You mentioned Dr. Shrishti's scans, right? So, how often should someone go for checkups or scan? And can you shed some light here?
Definitely. So, in most of the pregnancies, if I talk about how many visits a person should have, it's like once a month visit till 28 weeks. From 28 weeks to 36 weeks, it's like twice weekly, and then 36 week onward every weekly. And about the scans, it's like early pregnancy scan, which is done around 8 to 10 weeks. Then comes a 12-week scan, which is NT scan. Another most important scan is anomaly scan, done at around 20 weeks of gestation. And then 28 weeks onward, growth scan, maybe one or two required. So this keeps a track on both mother and baby, and any high risk or so, we can recognize it well beforehand and can treat it well.
Right. So, on a day-to-day basis, you must meet a lot of moms to be, and they have a lot of questions, and they're filled with questions. They just keep googling what to do, what not to do. Right. So, I'm so sure you hear about every day about struggles like nausea, exhaustion, back pain. So, what are some simple tips, quick tips you can suggest to make them feel better at least, Dr. Priyanka?
I think the network is not favoring
Hi.
us. Can I take up the
Yeah.
question?
Yeah. Sure. We can proceed.
Okay, so in that case, this is definitely a real thing, nausea and eating, exhaustion, back pain, and all these things. So, eating small, frequent meals, having big, large 3 meals instead of that, having small, five times a meal is a very better way to start with it. It will help you relieve your nausea and it will not let your stomach being empty. So, you're having your full diet, baby is also having the full diet. And for backaches, if I come, proper posture is very important. Then gentle stretches maybe you can do, and pregnancy safe yoga can start with to help it with.
Yep. So, these are great tips to get started with, right? Basic only, but again, it will come a long way. So, there are some complications also. We can touch them quickly, right? Like anemia, gestational diabetes. So, we
Correct.
can, you can tell me how serious they are. Dr. Priyanka, can you shed some light on these simple complications?
Actually, my network was gone in between. Can you please just repeat the
Yes,
things? I
yes.
was disconnected for a bit.
No worries. So there are some small complications like anemia or gestational diabetes are there, right? These are a complication that occurs. So can you quickly explain how serious are they and what are they?
Definitely. Actually, anemia and gestational diabetes, they are at increasing trend these days because of poor nutritional value, especially anemia. But yes, if they are detected well in time, we can definitely manage them really well. So anemia and diabetes as well, if you go for regular checkups, you can get them diagnosed early, and with proper prenatal supplements and medical facilities available, they can be treated well. So thing is, a proper seeking care and regular checkups are the key.
Correct, correct. And often moms feel guilty if something goes off track, but it's not their fault, I would say. Our bodies are already doing so much.
Agreed. Like moms do need to show themselves some extra compassion during this beautiful journey. Now, one of the most asked question is, what about mental health during pregnancy, especially during pregnancy?
Wow. I would say it is as important as physical health. Hormones are doing their job, so there will be mood swings. So, mood swings are normal, but if it is persistent anxiety, you're feeling very disconnected, sad all the time, that's not okay. So, moms, you should recognize this. Every mom has to recognize this and seek support from their family, counseling and therapies, even just go and speak with your doctors. It would really help.
Yeah, and even families and partners should also look out for signs if she's feeling sad or not. It's their
Correct,
responsibility as well.
correct,
So,
definitely.
partners and families do play a major role, right?
Major, major.
Definitely.
These are the first people who are in contact with the mother, and they should recognize the thing that something is going wrong with the mother and should definitely seek help.
Okay, so now with the beginning, now we will switch the gears, and Dr. Priyanka, after the baby arrives and the real struggle starts now, the world is crazy and the real worldwide begins now. So what actually happens in the postpartum phase?
See, being a gynecologist, I thought I would totally prepare for it in my postpartum period also, but actually, there's a lot going on. You are not prepared. There are sleepless nights, there are breastfeeding issues, there are sore nipples. There are so many things which are happening for the first time. So, जितना भी आप सोच लो you're prepared for it, but actually you're not. So, but what is the thing is कि अगर you seek proper care and your family is there to support you, then you can easily say it through it very easily, very smoothly.
Correct. I always say delivery might be one day, but recovery takes weeks, and it takes a village to bring up a baby. Very common.
Definitely agreed. So let's talk about emotional health for a moment because it's such a huge part. Females are considered mostly as emotional beings, right? So their hormones are haywire and they're every places. बहुत सारे changes आ जाते हैं. So how do you tell if it's just baby blues or something more serious?
See, usually what baby blues are, it is a very common condition. Every third woman may experience it. Usually it takes, you start having these symptoms after 3 or 4 days. But yes, there is feeling of sadness. You may feel worthless. You may feel कि आप baby के लिए enough नहीं कर रहे हो. People's pressure and community's pressure add on to it. But yes, right. Agar if it is prolonged, you are not having proper appetite, you are feeling sad all the time, and you're feeling like emotional bursting out, you should always seek help to it if it persists and if it is prolonged.
Correct, correct. And if those feelings, stick around longer to you, or if you start really feeling very low, hopeless, disconnected from the baby, or even like just, you feel you are not you anymore, okay?
Yeah,
That could be
exactly.
just postpartum depression or anxiety, and it deserves help, not shame.
Definitely, definitely. Because there is a taboo around seeking mental help. People think कि मतलब बहुत taboo है इसके around. There is this feeling, and people don't seek out help for this. And
Correct,
seeking help is the major thing here.
correct, correct,
Agreed,
correct.
agreed. So all of these things make so much sense now. So coming to a very, very practical question, ki after the delivery, after all these things, a lot of my audience must also want to know when a female can start the workout, the intimacy part. When can she start?
See, mainly in the postpartum period, for workout per se, she can start breathing exercise and other after 2 or 3 weeks only. But proper workout after normal delivery, 6 weeks at least, and after cesarean, at least 3 months. Because I am a cesarean mom, and I started my breathing exercise around after 1 month, and after that, regular core exercise and other things after 3 months. So that way you can recover, and along with exercise, yes, you have to take good proper diet, and
Agreed.
intimacy per se, a gap of 6 weeks is recommended.
Okay.
Yeah, correct. Maybe you can just start small, okay? Maybe a short walk, a gentle pelvic floor exercises. The goal is not to just bounce back to your
Right.
previous routine. It is just to start loving your body slowly and again after the postpartum period, I would say.
Exactly, क्योंकि when I was there, no, I was in a rush कि मुझे weight lose करना है, मुझे सब अभी कर देना है, but actually नहीं होता है ऐसा. अब mentally आपको लगता है, आपको body shaming लगती है, बहुत सारी चीजें लगती है, but yes, you should give yourself time.
Time, definitely.
Okay. So, uh, emotional health is covered, mental health is covered. That makes me bring to the baby is there, right? Baby poops, baby diapers, baby feet, eat,
Correct.
sleep, feed, repeat, right?
Yes.
So there is no time for us or the moms basically. So,
Me
which
time.
leads me to ask the self care, right? So once the baby is self care is out the window, goes flying. So what do you recommend, which is actually doable and will not take a lot of time and simple for new moms actually?
कि बस अपने लिए थोड़ा टाइम निकालो. दैट इज व्हाट आई वांट टू सी. पूरे दिन में आपका खुद का मोमेंट जरूर होना चाहिए. एंड यस, यू कैन स्टार्ट विद सिंपल थिंग्स लाइक यू कैन प्ले योर फेवरेट प्लेलिस्ट, यू कैन गो आउट फॉर अ वॉक, यू कैन गो आउट फॉर अ ड्राइव, you can have something which is your favorite. Like that you can proceed, you just need to be you, actually.
Right. Okay. So I loved all the solutions, all the tips. They are so incredible and so simple and so useful to all the new moms, which brings me to a very important question, that is breastfeeding. It's beautiful, agreed, but it's painful for a lot of new moms. So
Definitely.
it can be tough in the beginning, right? It will get easy, right?
Yes, actually, breastfeeding, especially for first time moms, when you're not prepared, you don't know what is proper latch, what are the basic positions where how you should be breastfeeding, what should be your diet. Yes, it gets tough in the starting, and but gradually, when you'll seek help, you'll be having support, and you'll learn gradually. Everything has a learning curve. So definitely, as time passes by, you learn things. You need not to have self doubt. That is what is important. And yes, even lactation experts are there. Your doctor is there. You can always consult. That is what is there. Self doubt nahi aana chahiye, because so much advice is there. No, ये कर लो, वो कर लो, ये खा लो, वो खा लो. But actually, ठीक है. It takes time and it
Takes
happens
time.
on its own pace.
Correct. Actually, no one expect you to be pro on day one.
Exactly.
It takes time, patience, support, just like everything else in motherhood. And the main funda is in postpartum period is believe in yourself. Okay, once you believe, yeah, my breast milk is coming, baby will feed naturally, and you will also be
Exactly.
very happy and satisfied.
Right.
And especially in C-section moms, especially, it might take 3 or 4 days. जब आपकी diet normal resume होती है, your antibiotics are tapered off, तब breast milk supply actually increases later on.
Acha.
Correct, definitely.
Okay, so a lot of things have been covered, and this session has been a lot of rich and reassuring to the new moms or pregnant moms, right? So, before we close, what are the three decisions a pregnant women family must make to secure their baby's future, according to you?
I believe first is take your prenatal care very seriously. Second, build a support system around you. It's now, time is now, not later, okay? And three, you can consider stem cell banking. It's a one time chance where the umbilical cord blood can be collected painlessly, and those stem cells are really, really powerful. They can treat 80 plus diseases, and that is of now. Tomorrow we don't know where it goes and what does it treat and cures.
Yes, actually, it is a one-time investment for securing your baby's future. And yes, I wish you never need it, but yes, in case you do, it will be a lot of help.
So, to all the moms in the session, to all the pregnant moms, do enroll for stem cell banking and go check out our link in bio today. And I have one question I asked, right? Dr. Shristi, Dr. Priyanka, every gynecologist, and like I also have a doctor gynae, right? So there is some funda, there is something they recommend, like anything, like they would, there is their, this is their motto they live by, and they would recommend to their every patient. So is there anything you suggest your patients, or whatever that is, that this is a must and you should, like whatever, don't stress. My doctor once recommended you drink water and everything will be fine. So, anything you want to suggest before we
So
close the
from
session?
my side, where I am practicing now, people are very, very superstitious. They think कि actually, मतलब medical advice को they consider inferior to their superstitious beliefs. Believing is one thing, but yes, superstition is another thing. No, every day I get a one patient, they say कि 5 महीने तक इसलिए नहीं दिखाया क्योंकि बाबा जी ने बोला था, या फिर 5 महीने पे बच्चा बन जाता है क्या. इट इज नॉट सो. आई जस्ट वांट टू टेल कि एडवाइस बहुत मिलेंगी प्रेगनेंसी में, बट यस मेडिकल प्रोफेशनल की ही एडवाइस फॉलो किया करो. दैट इज व्हाट आई वांट टू टेल. एंड बी रेगुलर विद योर चेकअप्स. नो, पीपल मिस ऑन देयर चेकअप्स. तो ये मुझे नहीं लगता. बस रेगुलर चेकअप्स कराओ, सुनो सबकी, पर करो मुझे लगता है डॉक्टर की या फिर क्वालिफाइड मेडिकल प्रोफेशनल की.
Definitely. मैं भी यही कहना चाहूंगी कि pregnancy it's not a disease, no, it's a normal thing. Every woman has to undergo that. So there is a doctor sitting right there next to you, every nook and corner to help you out. Okay, so ये एक natural process ही है. बस हम थोड़े से आपको और additives देते हैं कि कहाँ पे क्या कब स्कैन कराना है, कौन सी मेडिसिन लेना है, and just the basic medicine, iron, calcium. Yeah, there are certain group of people जिन्हें कुछ extra medication या help की requirement होती है, agreed, but then please follow your doctor. Don't follow what everyone else says or give you small advices. Listen to your doctor, discuss with your doctor, and take your decisions.
यस एग्जैक्टली. बस यही मैं भी यही कहना चाहूंगी, क्योंकि लोग है ना, मतलब कोई क्वैक जो गांव में प्रैक्टिस कर रहे हैं उनकी बात वो मान लेंगे.
Definitely.
somebody जो पड़ोसी बोल देंगे वो मान लेंगे, बट डॉक्टर को दे
Doctor
क्वेश्चन मेनी अ टाइम्स. आई डोंट गेट ऑफेंडेड बाय गेटिंग क्वेश्चन, बट यस फिर एंड में आपको माननी सही बंदे की चाहिए. मेरे को ये लगता है. वही है. दैट इज व्हाट आई वांट टू से. एंड रेस्ट, I wish you all a very happy pregnancy and your postpartum journey as well. कि सब smooth रहे, सब अच्छा रहे.
Okay, so we have one question from the audience: whom to reach out to, a regular therapist or a specific doctor for baby blues?
See, first, you can reach out your gynae, who's with whom you are friendly. He'll see if there is need of a therapist or not, and then she'll guide you accordingly. This is what I see, because sometimes it might be a regular feeding low thing. So yes, firstly you should reach out to your gynae. Then she'll
Definitely. Even
guide
I
you
will
accordingly.
say the same. Even I will say the same.
So, Dr. Shrishti, one more question: how important, from audience only, how important is partner support during pregnancy?
Oh my God. I mean, that's the most important thing, you know. Most important thing. The person you are dependent completely, emotionally, physically, everything. That person has to take care in every phase of your pregnancy or even postpartum phase. That person should be the first person who should notice any changes in you. You know, he should help you, support you in every way he can. And even the mothers, even if anything is happening to you, also you have to speak out to your partners. Say to them, ask for help. It's okay, completely okay to be emotionally and physically dependent on someone in this phase. Completely okay, but ask for help.
Yes,
Okay.
exactly.
So I think this has been a wonderful session, and we are going to save this session so you people, the audience, can share it with someone who wants to hear it. To all the moms out there, to all the moms to be, you are seen, you are heard, and you are never alone in this beautiful journey. Okay.
Yes.
So with this, the session comes to an end, and I hope everyone had a wonderful time. And thank you, Dr. Shrishti. Thank you, Dr.
Thank you
Priyanka,
so
for
much.
joining us.
Thank you for having us.
Okay. So that's all wrapping up. Bye, everyone. Have a good day.
Bye everyone. Take care.